Hi, I'm Dale Sherbeck, and welcome to the HQ, a CHA Learning and Healthcare Can podcast serial where we dive into healthcare issues and topics from the perspective of its people and discuss them with those that are leading in the health system. Together, we'll try to unpack these topics and learn what actions are being taken to innovatively solve them today. As our many active listeners know, we spent about a third of our episodes in 2022 exploring many of the concepts fundamental to inclusion, diversity, and equity. While these three terms have become increasingly focal and common in our lexicons, they are oftentimes accompanied by other words that deepen their meaning and relevance. Examples we included in our own series were words like indigenization and reconciliation, words like justice and ethics. But there is another word that comes up, especially in the context of healthcare, that is equally important in driving meaning, and that is access. It is, after all, one of the principles of the Canada Health Act. All that said, inclusion, diversity, equity, and access have a great and neat acronym like I.D.E.A, are also critically important to the sometimes overlooked kin of healthcare, and that is the broader health sciences and health research so critically important to the innovations that manifest in healthcare. Health and the life sciences need to work together like a pair of ice dancers to allow us to research, manage, and heal from things like COVID-19. And so it is the relationship between I.D.E.A, innovation, and better healthcare that we will explore in today's conversation. And there is no better person to have that conversation with than Dr. Ryan Wiley, president of Shift Health, which he has helped to grow into one of the most dynamic and trusted advisory teams within the health research and innovation ecosystem, and which has footholds in North America, Europe, and the Middle East. Working with global leaders in the context of business, healthcare, science, policy, and social justice, Ryan is committed to creating a healthcare future that is collaborative, inclusive, and person-centered. Ryan received his Ph.D. in immunology from McMaster University, where he is now adjunct professor. He is also a policy advisor to and past chair of Research Canada, co-chair of Life Sciences Ontario's annual policy forum, a founding member of Building an Inclusive Life Sciences Future and the Inclusive Life Sciences Collaboration, chair of Amref Health Africa in Canada, and a director of the board of Can Health International. Ryan's accolades also include being honored with Research Canada's Leadership and Advocacy Award in 2019 and the Life Sciences Ontario's Volunteer Award in 2022. Hi, Ryan, and welcome to the HQ.
Thanks, Dale. I'm delighted to be here.
Yeah, thank you for joining us today. I hope that your own entry into 2023 is coming with some wisdom about how we might manage sort of all these competing crises that we're facing. So Brian, maybe if we can start our conversation today, Shift Health may be a new name for some. So perhaps we can begin with who you are, who is Shift Health, and I'm especially interested in your inspiring tagline about that it takes a science mindset. So maybe sort of start with that background and what all that means to you.
Sure. Thanks, Dale. I'm happy to elaborate on Shift Health, and I'm not sure if 2023 has started with wisdom, but it certainly has started in a very hectic way, but in a good way. So Shift Health, as you pointed out in your very kind introduction, is a strategy consultancy that works exclusively with the health research and innovation ecosystem. So we're working really across the board with academic institutions, with research-intensive hospitals, with health charities and not-for-profit organizations, with government agencies that are developing policies and investing in research and innovation, and of course with the private sector, with the companies that are generating innovations and bringing them to market and bringing them to patients. And our goal in all of our work is really to maximize the ability of our clients to engage in cutting edge research and to get their innovations to patients and to the market. That's really what we aspire to do. And so we like to think of ourselves as part of the constellation of organizations that are helping to create the future of healthcare and ultimately improve human lives. And so for us, ensuring that future is equitable, inclusive, and just is critical to our mission as an organization.
Hmm.
And so you're right. Our tagline is "It takes a science mindset," which we also love, and I think it describes us quite well. And it has a couple of dimensions for me. So first, all of our consultants, myself included, are scientists by training.
Hmm.
Most of them are at a PhD level. So we bring that scientific acumen and perspective and skills to the work that we do, and that's important because we're working exclusively with science-based organizations. So we really do need to have a technical understanding of how of the content of how those organizations operate in order to provide more relevant strategic insights. But the other dimension for me that's important is in terms of how we approach our work, what
Hmm.
that scientific mindset brings to the work and the experience of what we do. And it's a few things. It means that we are very we care a lot about data and are very skeptical of data and very critical of it because we feel there's a great responsibility that we hold as scientists to ensure that the information, the data that we're collecting are robust and reliable and reproducible and defensible. It also means that we approach our work with a lot of curiosity,
Hmm.
with the curiosity of a scientist and with the courage of a scientist to ask tough questions and to create rigorous methodologies to answer those questions and to answer those questions in a way that is transparent, that has integrity, and that aspires to clarity. So it's not about for us and our deliverables, it's not about the number of words on the page. It's really about the clarity of the insight that we're able to generate because we've taken a scientific approach. So that's for me what a science mindset means. But to link it back to the I.D.E.A, inclusion, diversity, equity, and accessibility, to have a science mindset means that you need to have an openness to ideas, to the unexpected. So you need to be alert and aware and ensure that you are leaving no stone unturned. So that openness, I think, is central to I.D.E.A. It means you have to have a certain level of humility in your work, that to accept what you don't know or can't know, and to work hard to try to understand um, uh, uh, the experiences of others and the sort of diversity of the world. And it also means that you recognize that the more voices you have at the table, the stronger your insights will be, the more relevant, the more reliable, the more accurate, and the better ideas. You'll have better ideas
Hmm.
to work with. So for us, um, I.D.E.A is not simply sort of a moral imperative. It's also fundamentally to our ability to perform our work and to deliver value to our clients.
Yeah, and I think that makes sense. I mean, one is, I do think that I mean, I really do love the tagline, love to have it on a pin, and because I think it defines a lot of even what we're trying to do through the podcast itself, and in my own personal life, and I do like the way that you in some ways you're using, I guess, the words almost synonymously about science and idea, in that sense that there's an implicit curiosity, right, in both of them, about learning and understanding. So I guess I'm also curious then. I mean, you've been a leading voice in the space around equity, diversity, inclusion, accessibility for some time, and it's I think in the conversations we've had before and in some of your work, it's clear that this is critically important to you as well. So,
Mhm.
um, and in your work in the life sciences, which you touched on, I think a little bit there, but maybe describe a little bit why is that so important to you, and what's driving you in this direction.
Mm, mm. I think to answer that question, Dale, I think I need to tell you a little bit about me as a person,
Sure.
because at the end of the day, my interest and commitment to IDEA and to living IDEA as a leader and in our work is very personal to me. So, you're looking at a white, I hate to say middle-aged, but 47-year-old leader of a life sciences organization of a consultancy, and that sort of has a certain biases it will conjure up, and certain assumptions about who I am. But I'm also a gay man, and that's important because growing up as a young boy who knew he was different from the other boys but didn't quite know what that meant, was a very terrifying experience,
Sure.
and a difficult one, and growing up, and certainly into my own sort of awakening. That journey was certainly distinguished by prejudice, by exclusion, by verbal and physical abuse and violence, and so I certainly understand the experience of desperately wanting to feel included and not understanding why. I understand the experience of pragmatically but painfully and traumatically suppressing your own identity simply to get through, simply to be part of a crowd, and to get through an experience, to get through the day. And I'm not telling you that story because my story is tragic. It's not tragic at all, obviously. I've been very successful and very privileged throughout my life, and so that's not the reason I'm telling you, but it does inform certain lived experience and awareness that impels me to ensure that that the inclusion that I now feel, the sense of belonging that I now feel, is experienced by everyone.
Hmm.
And the other reason I tell you this story about me is that I have experienced the possibility of change over the past 20 or 25 years since my own coming out, that the world can change. The
Hmm.
the the privileges that I enjoy now, the ability to live my life exactly as I want it, is a remarkable transformation in a fraction of a lifetime, and at least for privileged white gay men like me, and I think that's a really important consideration, to understand that change is possible, change can happen with the right leadership, with the right intent, and by building bridges, and by building a community. So that is important to me, and
Yeah,
I
and
think. Sorry, go ahead.
it's yeah, no, and that's very powerful, and thank you for sharing. And I think it's not having had those experiences. I mean, that it's what you do with those experiences, I guess, as you're sort of saying, right? I mean, some people can have those challenges and choose to live terrified, and perhaps not engage and run from something. And it looks like you've taken those things and infused them in your work and your desire to create that change too.
Yeah, absolutely, and I have a lot of work to do, and certainly a lot to learn through this. It's a constant learning journey, and I think that's also part of it. You need to have the humility to accept that we I don't know, and I need to approach this job with due humility. but it's partly personal, as I mentioned, Dale, but it's also very practical in terms of why I'm engaged in this and why our organization is engaged in this work. Because when you look at the life sciences as a sector, recently, BioTalent Canada released its labor market report, I think last fall. And for the first time, they looked at measures of diversity within the life sciences workforce. And it is, there's no other word, but it's abysmal. The life sciences workforce is quite homogeneous. And this is at a time when the life sciences sector is struggling to find talent, is struggling to fill job vacancies, and has huge labor market challenges. So at a time when we are unable to find workers, we are also systematically excluding large fractions of the population from the labor pool within the life sciences. And that starts at the very earliest stages of kids' development, when they're making choices about whether they belong in STEM, in science, technology, engineering, mathematics. So it is a challenge that we need to tackle as a community to ensure not only that diverse groups, and particularly underrepresented groups from the life sciences, find a home in the life sciences sector, but it's also essential for the survival of the life sciences sector in terms of its ability to attract talent and fill and grow in the way that it can. And I think another reason why I'm engaged in this work, and we're engaged in this work, is that the life sciences sector is dominated by small and medium enterprises. The vast majority of the life sciences workforce works in SMEs or in companies that are probably 50 people or less. And the challenge with SMEs in the world of I.D.E.A is that they don't generally have large or any human resources capacity.
Yeah,
they don't. It's not professionalized within their organization. They're doing HR and people work off the corner. Leaders are doing it off the corners of their desks. They don't have the expertise and training and knowledge and idea, even if viscerally and philosophically they agree with and would like to promote equity within their organizations, they don't know how to do it and they don't have time to do it. And so we have an inherent challenge within the life sciences of providing and upskilling idea within SMEs to ensure that they're recruiting in inclusive ways and that they are supporting talent within their organizations in ways that supports diversity and sort of inclusive excellence. And I think the other thing I would say here, Dale, with respect to why this is important, is that I think that science generally, especially hard science, struggles with I.D.E.A because we are, there's a certain sort of conceit almost within science. It's certainly a bias or assumption in science that we are, knowledge is universal. The scientific method is sort of objective. That the purpose of science as a whole is to remove bias from your work. So that's the goal of science, is to remove bias. That that excellence is singular. That our systems ultimately reward merit, reward the quality of your ideas. And we know that that's not true. We know that science is not neutral, and systemically and institutionally reinforces structural bias that excludes voices and actually limits creativity and curiosity. But it's hard sometimes to get through to science as an institution and to individual scientists that I.D.E.A is important and relevant to their work because of the baggage that science carries as sort of is the arbiter of truth and objectivity.
Yeah, it gives us sort of a false sense of security, I guess, that you assume because it is presumed to be a merit-based and a knowledge in pursuit of knowledge that it is somehow safe and above, I guess, the same kinds of challenges that we face socially, and then that, I guess, almost creates a bit of a blind spot, I guess, within the sector.
It really does. It really does, because it forces organizations and the scientific community to understand that the knowledge that we're building does have distortions, does have biases in it, is not reflective of the fullness of human experience and knowledge and ways of knowing, and that's sort of it's difficult to reconcile with sort of the assumptions upon which science is built. I mean, I think a lot of institutions and I think the scientific community are increasingly having that awakening and beginning to tackle some of those challenges, but there is, of course, institutional inertia. These are very complex systems, very large institutions with hundreds of years of history. This is not something that can be reversed overnight.
Yeah, and I'm not sure, I guess, in the health sciences sector itself specifically, that's not my background, but in my own sort of time in academia, my own observation is that academics, right, can be, in doing their work, their research can also become highly proprietary of that, highly defensible of that position that almost defines them as a person.
Yes.
Right? They become defined as the person who has this particular theory and they will defend it at all costs for the rest of their life.
Yes.
Which is contrary to this, I guess, that scientific method of proper debate and just studying, right? So is that part of what you're describing as well, I guess?
It is for sure. And I think you've hit on an important point there, Dale. That the strength of science ultimately hinges on our ability to challenge each other, and our ability to challenge each other is enhanced when we have a diversity of voices around the table, asking different questions, bringing fresh and alternate perspectives, and really forcing us to defend what we think, as opposed to operating within an echo chamber. And that's what makes science stronger and more relevant, more objective, and a better description of what we're observing. And so I would say that I.D.E.A, going back to our earlier conversation, is intrinsic to or should be intrinsic to the scientific method and to scientific systems.
Yeah, it makes perfect sense, and I think we'll come back to that in perhaps in some of the other discussion points here. But maybe if I can just sort of bring it to in an article that you and your colleagues published, I think almost 2 years ago, you wrote, quote, "Many organizations are taking concrete action critically important to embedding I.D.E.A principles, but durable change will not be achieved until I.D.E.A becomes a core leadership competency." So I guess, what does that mean and look like to you? I mean, so just to unpack that a little bit more.
Sure. So I think an important place to begin in unpacking that is to think about what is a leadership competency at all? Like, what do we mean by leadership competency? And there are lots of different frameworks for leadership competencies within healthcare and beyond. But there are a few things that are generally quite common across these frameworks, and a few things stand out in terms of defined leadership competencies that allow leaders to lead. One, of course, is to have a sense of fairness, of justice, of sort of an ethical framework
Mm-hmm.
within your leadership. That is a critical competency. The ability to manage change and to bring new ideas to the table, to innovate, and to lead teams through that process of change and innovation. Um, Third, a commitment to an understanding of how to uplift talent. So how do you develop talent?
Mm-hmm.
How do you develop leaders, nurture them, mentor them, and allow them to fulfill their potential? Um, Fourth, leaders will model excellence. So what is the standard to which we're aspiring in our behavior, in our interactions with each other, in the quality of our work, in our values? They are serving as the model to which others are aspiring. And then finally, leaders, another competency of leaders is to understand their accountability for results, and their ability to communicate that in meaningful and authentic ways. So those are 5 standard leadership competencies or practices or attributes that excellent leaders will demonstrate. And you can understand how I.D.E.A can and should inform all of them. That is a focus on understanding of inclusion, diversity, equity, and accessibility makes you more just and fair in your decision making, it puts you in a better position to manage change, particularly when that change is difficult.
Mm-hmm.
It is certainly critical to your ability to develop talent, ensuring that you're able to develop all talent, the fullness of humanity. It allows you to model a standard of excellence that is inclusive of different forms of excellence and expression,
Mm-hmm.
and it diversifies your understanding of what results you're looking for and for which you are ultimately accountable. So all of those things, I think, are essential to infusing I.D.E.A within standard leadership competencies, and I think what I can say is it's very easy, I would say, to embed I.D.E.A practices within your organization when everything is going well. So
Yeah.
when it's limited to when you've got the employee resource group or the affinity group, or you're observing and celebrating identity associated days, whether it's LGBTQ plus, 2S plus, or Asian Heritage Day, or all of these. That's fairly easy, but when it comes down to making tough decisions and having tough conversations, that's when it's very easy to make purely the business decision and to neglect the discussion of equity in the decision, in that decision. And by seeing I.D.E.A as a leadership competency, you understand that every decision you make is informed by I.D.E.A principles. It's at the forefront. It's a question you ask yourself. What decision do I need to make? And is that decision going to enhance equity or be informed by equity? And that's the real test of whether I.D.E.A principles have really been embedded within your organization, when you have to make those tough choices and you make those tough decisions with through an equity or an I.D.E.A lens.
Yeah, and I mean, it brings to mind, something I'd heard previously, right? That it's easy to follow rules, right, or abide by rules when the rules are in many cases least necessary because they're not threatening,
Yeah.
right? It's in those moments of when it's difficult, right, where the rules are, perhaps most important, and they're the hardest time sort of to follow them. So,
Yeah.
so I guess part of, you made a point there in terms of that in those spaces as well, when the business perhaps might be driving things a little bit differently or forcing decisions. So maybe I can just sort of ask you in that space about, um, you know, how does the bottom line figure into these decisions, right? Um, we have these ethical imperatives that we're trying to follow, the morality of and our humanism and all of those things that I guess that drive our social justice. But these are businesses in many cases, as you're describing, and the bottom line is an important part of that, a business's survival. So how do you manage that, or how do the organizations you consult with sort of manage those, I guess, those juxtapositions?
Yeah, no, it's a really good question. I think a number of ways in which I can sort of tackle that, but I think an important point is that in any human relationship, and particularly in a relationship between a leader and the larger team, the strength of that relationship and the ability to leverage that relationship in your position as a leader ultimately hinges on trust. You need to have trust in your team, and your team needs to have trust in you. Trust that you're making decisions for the right reasons, with the interests of people and of the business in mind. And if you treat I.D.E.A as central to your decision making, as central to everything that you do, as a leadership competency, um, everyone in your organization will have a heightened level of trust in you as a leader. And when you're making those tough business decisions, the thing you want most is trust. You want to be able to tap into that reserve of trust, because you want, this is when you need people to come together, to pull together behind you, with you, so that you can get through a difficult situation. If you don't have those bonds of trust, you quickly, the organization can quickly erode from a cultural perspective, and ultimately, the tough business decision is that you've made is going to force you into other tough business decisions down the road. We're seeing this right now within the life sciences. We are in a difficult space, global, macroeconomically, globally. We're in a difficult space. Lots of organizations within the life sciences and beyond are shedding jobs in anticipation of a recession, or because they feel that we're already in one. And the question is, and I'm not casting aspersions, I'm not judging organizations. They have to make the decisions they have to make, but to what extent has equity informed those decisions to shed tens of thousands of jobs from organizations? How has equity figured into those conversations, and what is the impact on those who are left behind in terms of their trust in their leaders and their trust in the organizations that they work for? I don't have an answer to that question, but it's a question that I ask myself. So I'm not sure if I've totally answered your question, Dale, but I think that's an important point to raise.
Yeah, and I guess maybe, and not to put words in your mouth, but what you're describing and gets me thinking that trust in that equity is kind of an investment in social capital, if I could be presumptive. And but the emphasis on the capital, right? That is something that can be invested back within that organization that, if I'm assuming, right, does impact that bottom line at some point in time.
It absolutely does, because you have the loyalty and the commitment of your team to pull through and to deliver. And more broadly, when you're sort of talking about, when we're not talking about a crisis decision or a difficult decision, but more broadly for the business, there are lots of advantages to embedding I.D.E.A within your organization from a business perspective, from a bottom line perspective. Certainly it burnishes your reputation as an organization, particularly for in a competitive market for talent. Anecdotally for ourselves, we through the pandemic, at a time when employees were moving from job to job, when organizations were struggling to attract and retain talent, we've had, frankly, no difficulty at all recruiting talent, retaining talent. We've had virtually no turnover within our organization. We attract a huge pool of applicants, and it's partly and explicitly due to our position on I.D.E.A and the authenticity with which we express that. And you can rest assured that applicants who are looking at our organization and looking at other potential jobs are speaking with members of our team and asking them, okay, I see what Shift Health is talking about on its website and through its social media. What's the actual experience like? And so they're making those decisions based in part on the extent to which a workplace embraces the principles of I.D.E.A, and they've told us that they've come to us ultimately because they want to do the work, but also because we have taken a strong stand on I.D.E.A. So that, from a business perspective, is critically important, because one of the biggest investments we make is in attracting and training our talent. It's a huge investment, and to have significant turnover in your talent pool is erosive or erodes your bottom line, takes resources away from other areas where you should be investing them. So it's a very, very basic business concept.
So maybe just, so I think you made the business case for it in some of what you've just been describing, and you've described some of the competencies and the leadership competencies that are necessary to create that change and make it more durable. So I guess, what are the pain points, or what are the barriers that are preventing that from happening?
Yeah. I think, broadly speaking, within healthcare or the life sciences, there are, I think, a few pain points that I would highlight. One is it's governance. So, if you're going to make I.D.E.A a leadership competency and central to your thinking and decision making as an organization, that needs to come from the top. And most boards, frankly, are not comfortable with or not well versed in conversations around inclusion, diversity, equity, and accessibility. It's not always central to their thinking. It's not always comfortable for boards to have those conversations, and so they're not necessarily modeling the behavior or the expectation for the leaders who report to those boards. And so if you're not doing that, then in terms of that leader's performance and how that leader is evaluated and judged and what the expectations of that leader are, I.D.E.A may not be part of that evaluation. So that's one challenge that we face. Mm-hmm. And of course, we know that boards themselves are not consistently diverse in the ways in which they need to be diverse. So that also creates a barrier to making I.D.E.A central for those conversations. I think a second area of challenge is in mentorship, and there's a couple of dimensions here. One is the mentorship of leaders in I.D.E.A. It's not an expertise that necessarily exists within organizations. And so although there may be an intellectual or philosophical alignment with the principles, being able to mentor, to nurture those competencies and those capabilities in leaders is not necessarily an organizational competency, but also mentorship in terms of being able to mentor diverse talent. So if you have junior members of the team who are who come from racialized groups, for example, and are looking up and are not seeing people who look like them in positions of leadership, it creates an inherent mentorship challenge because those leaders do not necessarily understand the experience of those they're mentoring and the challenges, the unique challenges that they face as professionals who seek to rise within an organization. So that is a huge challenge within organizations, especially smaller organizations, which, as I mentioned, characterize the life sciences ecosystem. And then, of course, a third challenge is with respect to performance management and how do you embed I.D.E.A principles and practices within performance management systems? How do you ensure that? How do you measure the extent to which someone is exhibiting and living and the principles of I.D.E.A in their decision making? It's a fairly nascent area and certainly within the life sciences. So those are a few of the challenges I think that we face.
Yeah, and they're not insignificant.
No.
But I agree. I mean, there's when you're talking about some of them, right? It really is about starting at the top and creating spaces and right and those pathways for that. But I do your last point around the performance management and the measurement side, right? I think is around it. Well, it's an important mechanism around accountability, right? So, without that, then if you don't measure it, you don't manage it, I guess. And so, So, thank you. You've talked a little bit around the edges around the impact of diversity, I guess, within your science mindset and in terms of generating ideas and things like that. So it naturally sort of brings, I guess, to that sense of the link to innovation.
Mm-hmm.
Do you have more that you want to share on that that helps to sort of explain, I guess, how that figures in the work that you do?
Sure. A couple of years ago, a paper was published by an author, Hofstra, and colleagues that looked at the diversity innovation paradox. This was the title of the paper, and it was an interesting study because they looked at about 40 years of Ph.D. graduates and their dissertations in the United States. So I think 1.2 million dissertations.
Wow.
Yeah. I hope they use natural language processing to assess these things. But they looked at this and they looked at and I don't want to get into the details of how they measured degree of innovation, but when they looked at papers that came from individuals who were underrepresented students in higher education, so demographically underrepresented, they found that the dissertations from those students had a higher degree of novelty or innovation than the others. And that degree of novelty was measured in terms of the linkages to other areas, and you can dispute the methodology, but it was an interesting finding. So they found that sort of the diversity of lived experience drove greater novelty, brought fresh perspectives and ideas, which we kind of know intuitively. And they also found, though, that the uptake of that knowledge, of those dissertations, of the novel contributions from those researchers was lower than the uptake of the less novel dissertations, likely owing in part to the fact that those young scientists, those young researchers, did not necessarily have the mentorship that would be needed to navigate the research world. They didn't have the networks, the relationships, a whole host of factors that actually pushed those individuals out of careers in science. And so that's the diversity innovation paradox that
Yeah, it's a bit cliquey.
Sorry?
It's a bit cliquey.
Yes. Yeah, very much so. Very much so. Sorry. Very cliquey, very tribal, and that paper reinforced that. But at the end of the day, I don't need a paper to tell me that bringing diversity to the table increases creativity, innovation, and brings fresh ideas. I mean, I think we know that almost intuitively. It's almost almost axiomatic, actually, that the more experience you have around the table, the sharper your insights, the broader and more diverse your insights, and the more creative you are. And I certainly have never seen a paper that suggests that that diversity actually inhibits innovation. So I would simply I'll leave it there.
Yeah, but thank you for sharing, because I mean it certainly brings some ideas for me as well, and it's perhaps another kind of paradox, or but I guess it's the relationship between struggle, right, in some respects, and innovation, right? So, which I think, so on the one hand, in asking the question, I'm thinking about how organizations benefit from having diversity within their structures. But what you're describing from the paper, I certainly am struck by the capacity for innovation with individuals because they have to work so much harder because they are on the outside, and so they approach things innovatively or creatively, or right. And maybe even relating it to your own story that you had at the beginning of our discussion here. I mean, does that resonate with you, or how
Sure.
does that sort of fit in terms of your perspective?
No, I often say, Dale, that there can be no innovation without constraint. So innovation is about solving a problem within parameters, and so it is about struggle. It is about pushing and recognizing, again, the constraints in which you're operating, and that actually forces creativity. That invites questioning and fresh thinking, and so innovation is very inconsistent with complacence,
Yeah.
with comfort, and so I think you made a great point. I completely agree.
Yeah, I certainly, even in the use of that comfort, because I've, as a learning professional, right? I think that you can't, if you're in a comfortable space, you're likely not really learning. You have to be outside your comfort zone, right? To be stressed or pushed to be able to be able to learn. But that learning, I think, is what you're describing, translates into innovation and growth, I guess, for organizations. So, so I guess just bringing it back then in terms of how, if science is based on knowledge, then and that knowledge requires evidence, which ultimately, I guess, means data. But you said at the outset, your relationship with data. So I guess, what is Shift doing in the life sciences space, I guess, to respond to this or change it in terms of how data is used and in the space of I.D.E.A?
Yeah, so we have been very privileged to have the opportunity to participate in and help to form a number of initiatives to advance the aspirations of I.D.E.A within the life sciences sector. One which we have called Building an Inclusive Life Sciences Future, which you referred to in my bio at the beginning, is a partnership that we formed with Life Sciences Ontario, overseen by an amazing steering committee of leaders in I.D.E.A and individuals with lived experience, with the goal of developing a building a community of practice in the life sciences around I.D.E.A, identifying challenges within the life sciences sector that we can tackle together, and then developing an action plan to move us forward and hold us accountable to I.D.E.A. We have had an opportunity to convene a really wonderful large, multifaceted and multi-partner workshop about a year ago, at which we identified three major challenges within the life sciences sector that we want to tackle together. One being, not surprisingly, supporting and uplifting diverse talent and defining the career path, and really from earliest stages of one's development in science to leadership within life sciences organizations. Secondly, and as I mentioned before, the challenges that SMEs face, particularly given the resource constraints within, and how do we create a community of practice? How do we create shared resources that allow SMEs to embed equity and I.D.E.A within their organizations and cultures? And third, is simply articulating a shared understanding and awareness of the importance of I.D.E.A within life sciences, the relevance of I.D.E.A within the life sciences, particularly among leaders, many of whom have accepted that and embrace it, many of whom consider it secondary. And so how do we make it primary, sort of a primary driver of business objectives within the life sciences? And actually, that's the one that we're tackling first, because if you don't have awareness, acceptance, and sort of consensus around the importance of I.D.E.A, we're not going to be able to move the needle on the others. So that's what we're working on. Others. That's one thing that we're doing. We're also have helped to form an organization or a collaboration called the Inclusive Life Sciences Collaboration, which is really bringing organizations that are like-minded together to share knowledge and resources and ensure that we're pulling together. And I mentioned before the importance of building the talent pool in life sciences, particularly within underrepresented or marginalized communities at the earliest stages of childhood education. And so we are working with a wonderful organization called Visions of Science, which is focused on advancing STEM, particularly within underserved Black communities in the GTA and beyond, but also more broadly in underrepresented communities, really working with students, with partners, with educators, from elementary through to post-secondary, to provide those pathways and to ensure that underrepresented kids and youth and trainees not only see life sciences and STEM as something that is an option for them and is an attractive career, an inclusive career path, but also provide the supports to nurture that talent along the continuum. So those are a few of the things that we're doing, and really excited to be involved in those initiatives.
Yeah, amazing and very well. Congratulations and kudos. Um, Just I guess the first one that you mentioned, right, which is about trying. I guess if I might paraphrase it, it is about almost even trying to build a culture in terms of how idea sort of might be represented in that space, and in the context of, the performance management part that you had mentioned before that. So how do you measure, or
Hmm.
how do you think, how would you imagine you might measure the impact or success of that?
Yeah, that's a great question. And in fact, we are doing that right now in partnership with Life Sciences Ontario, with Pfizer, and with I.D.E.A Biosciences. We have it's not yet released, but it will be hopefully very soon. The report, but we've been looking at we've undertaken an extensive survey of the life sciences ecosystem across Canada, the organizations within that ecosystem, to understand the status of I.D.E.A within their organization. So, what
Mm-hmm.
are they doing? What are the resources that they have in place? What are some of the practices in which they're engaged? From performance management, recruitment, talent development, training, leadership development, all of these dimensions, and really to understand what is the baseline, because we don't really know what's
Yeah.
going on in these organizations, and also to understand, well, what are the needs, where are the gaps, what are the differences between large and small organizations. As you can imagine, the differences are quite striking.
Mm-hmm.
And this has also involved focus groups with individuals, with equity deserving groups, to understand their experience of working within the life sciences in small and large organizations. What is working well? How do they understand the gaps? And so this is the kind of, so to answer your question, Dale, this is the kind of survey that we need to conduct every year or
Mm-hmm.
every 2 years to understand if there is uptake of some of the practices that we're espousing, if there is a change in culture, if there is a change in the experience of those with lived experience, of those equity deserving groups within the life sciences, if we're seeing a greater diversity through BioTalent Canada's market labor market report. These are the kinds of things that we have to do to measure, and it has to the measurement has to be routine, and it has to hold our whole sector accountable for those results. So we're at the beginning of this journey. Certainly, what we're measuring now probably is incomplete. We're going to learn from this experience and do better in the next survey. But I am encouraged, at least, that organizations are stepping up to support this kind of work, and ensure that we're holding ourselves accountable, and seeing that the plans, the strategies, the tactics that we're putting out there are actually delivering the results that we need to see.
Yeah, well, I think it's critically important, and I would love to, have you back after you've done that and sort of see what did you
Yeah.
learn from it. But I guess the other, I mean, maybe as useful as that is, I think, to take a broad sort of view of that and then have somebody objectively sort of measure these things. Do you think there's capacity to take what you're doing, or that right instrument, to create like an organization's like a self-evaluation, right, or a scorecard or something that they can use to take, whether it's the board that you described where that
Yeah.
change needs to happen, or somewhere along the line for an organization to evaluate itself,
Yeah.
and see whether they're doing the right things?
I do, and in fact, those instruments exist. BioTalent Canada, this past fall, inaugurated a program called the Ideal Bioscience Recognition
Hmm.
Program, which is a designation, a certification that organizations can seek to sort of objectively compare themselves against I.D.E.A leaders or I.D.E.A standards, and to be able to determine the extent to which they are showing leadership in I.D.E.A. The first 12, I think, or organizations were inaugurated into the first graduating class. We were one of them. We were very honored to be. This actually last week it was announced.
Awesome.
So it's again at the beginning, but that is the kind of tool that organizations should be using to understand. Okay, so these are the things that would make us a leader in I.D.E.A. These are the things, the attributes of an organization that has made I.D.E.A. central to its mission and purpose and decision making. So it exists, and I would encourage you to promote it broadly.
Yeah, well, yeah, maybe you can, if there's a link or something you can share with us, Ryan, after
Sure,
this, we can include it in the show notes for this episode.
sure.
Yeah, so that's great. Very, very powerful, and all of the whole conversation, I think, has been very, very positive and inspiring, uplifting. The work that, I mean, obviously you've been clear that there's lots that needs to be done. There's a huge opportunity and need for this, but you've clearly provided inspiration in terms of what can be done for those that really embrace these values as part of their personal and organization identity. So, what more, I think, just maybe leaving sort of last words to you, Ryan. I mean, what more do you think needs to be done, or any other comments that you might have as we sort of take this to a close?
Mm-hmm. Well, I wanted to return to sort of the business case for I.D.E.A, which
Mm-hmm.
we touched on, and I talked about it primarily in terms of an organization's ability to create bonds of trust that are so essential to a leader's ability to make decisions and to take the organization in the direction it needs to go, but also in terms of your competitiveness for talent, your ability to retain outstanding talent and develop that talent within your organization. Those are all very strong business cases, but also, the business case extends to very, very pragmatic financial implications. So for us as an organization, our clients increasingly expect us to show leadership in I.D.E.A. They want to know and understand that the methodologies that we're applying in our work, the consultation methodologies, the engagement methodologies in our strategic planning efforts, embed I.D.E.A, are at the cutting edge of I.D.E.A, and they're also looking for our advice in I.D.E.A. They're looking for that kind of intellectual leadership and partnership. And for other life sciences organizations that are competing for funding, especially from public sector, from government sources, if they don't have a strong I.D.E.A foundation, and are unable to justify and defend that foundation, they're not going to be able to compete for that investment. And so it's it is also a numbers game, and a very, money talks. And so if money is going to incentivize I.D.E.A, well, that's great. So, but you said the conversation has been very positive and optimistic and uplifting and inspiring, and I'm really glad, because I obviously believe in this. But I don't want, I don't want to leave the impression that the pursuit of I.D.E.A within your organization is easy, or that it does not come without some tough choices. Sometimes, to do this work, it requires an investment. It requires an investment of your time as a leader, time time to learn, time to really focus on examining your organization through the lens of I.D.E.A, examining your practices, your policies, making the changes that are necessary. And it takes an investment of money. This is work. It is an investment that pays dividends down the road, but it takes that investment now, and in a world of finite resources, it means you can't do the other thing that you were planning on doing. And so
Sure.
these choices, you have to make them intentionally, but you need to be aware that they are choices. And I would also further say that, we as an organization work in geographies and contexts that are not always friendly to the principles of I.D.E.A, that are not always do not always share our values and our sense of human rights and human dignity. We work in those regions because we feel that we have something to offer and we can do so with integrity. But it does require some choices, and sometimes you have to choose not to pursue a relationship, or a relationship chooses not to pursue you. Because of your position on I.D.E.A, and those are choices that you make as a business and as a leader, and we've had to make those.
Yeah, well, I guess it makes sense, and just to liken it to, you know, other, I guess other kinds of conversations we're having socially. I mean, one is like, I guess I'm thinking about, um, climate change, and right, and the way we burn through fossil fuels and things, and right, and understanding that there's other costs, right, that need to be calculated than fiscal costs, and the cost to our environment, and uh, our society is a part of that. And I guess part of what I'm hearing as well from you in describing this is that, you know, I.D.E.A also brings other kinds of cost considerations, or value considerations or benefits, right? Than simply the dollars and cents. But it's just, is there, especially I guess maybe in small medium enterprises where there may not be shareholders in the
Mm-hmm.
conventional sense, but you may have other investors or venture capitalists or other kinds of things that, they're evaluating success based on one metric.
Mm-hmm. Yeah.
Right, but
Not all of
but
them. Not all of them.
not all of them, fair,
Yeah,
right?
yeah,
And I
yeah,
think that's the conversation, though, right? Is you're trying to get people to think about, I guess, those other goods. And but even as a leader in making those decisions, you also, yes, you may have left some money on the table, so to speak, but you maybe sleep better, you feel better about yourself, right? There are other kinds of benefits, I guess, that you're starting to calculate, and even be intentional about considering. I mean, is that,
yeah.
yeah?
For sure, for sure. And you have to take the long view, and you have to ask yourself, what kind of team do I want to build? What kind of culture do I want to have? What kind of impact does this organization want to have on the world? And we as leaders, we're faced with short-term decisions all the time, that are sometimes they're urgent. They may be, but they may seem benign, but may not be, and may have long-term consequences. So you've always got to have that long-term view in terms of, what is this organization about? What do we value as an organization? And what are the touchstones of our culture that are essential to our success, and that will allow us to succeed indefinitely? And you just need to be very intentional and very aware of those things, if you're going to succeed, and if you're going to build your company and your team. You may leave money on the table in the near term, but over the long term, you've created something that's resilient, and that has the focus on mission, the reputation, and the trust that is so essential to any organization sustainability.
Yeah, and I think resilience and sustainability. I think those are important aspects of this. And I not to take us down another road, and maybe subject for another conversation, but I am curious, perhaps, right, as we evaluate some of the aftermath of COVID, if there ever is a true aftermath period. um, but you know, which organizations in any sector, right? But even in this sector, right? Is there a correlation between survival, right? and those which were perhaps more diverse, right, in their capacity. I think of the other language that you used earlier in the conversation around the change, like leadership competencies around change management, right, and that capacity, how they pivoted, how they survived, and ultimately moved through this, and that's a big part of that business case. I think is what you're saying, right? Is that sustainability and that longer view. Those investments will provide you a stronger organization to grow and to survive.
Yeah, for sure. I think that survival in challenging situations requires a team that has a strong affinity to the organization and the vision and the mission, understands it, and is willing to work together, is very collaborative. That's essential to moving through a challenging time. It requires a team that is open, that feels free to express ideas, opinions, and so you're not guessing what the team is thinking. They're actually telling you what's needed and what's happening on the ground, and that visibility is so important to leaders, and particularly when you're going through a global challenge. And it also creates space to have the difficult conversations and make the difficult decisions that sometimes you need to make, and to do so without completely disrupting the organization and the culture of that organization. Again, going back to the issue of trust. So I think it's a great hypothesis, Dale, that those organizations that have a stronger idea conviction, those organizations that are more diverse and more inclusive of the human talent and experience, may have survived the pandemic better than others. I like that hypothesis. I don't think the study has been done, but certainly it's worth exploring. And I think you can guess what my bias would be.
Yeah. Yeah, fascinating. And this conversation really has been so. Thank you very much, Ryan, for sharing your time, your wisdom, your experiences so openly, both your personal convictions and that of Shift, and in terms of what the work that you're doing, and your commitment to making for a better life sciences sector and in society in general. So you've given us a lot to think about here today, and a lot of inspiration, a lot of ideas, not to use a pun there. So thank you. Wonderful conversation.
Thanks, Dale. Really a pleasure being here. Thank you for inviting me, and look forward to our next conversation.
Truly. Okay. Take care. You've been listening to the HQ, and I'm Dale Sherback, your host. You can find this and other future episodes on the CHA Learning website, Apple Podcast, or Spotify. We'd love to hear what you think, so please follow us on our other social media channels. Thanks for joining us in this discussion today. Please join us next time.